Hello and welcome to another episode of Your Therapist Needs Therapy. I'm your host, Jeremy Schumacher. I'm a licensed marriage and family therapist, and today I am joined by a local person. I love getting my Milwaukee area folks on the podcast. Today I'm joined by Laura Skinner. Laura, thanks for coming on.
Thanks for having me.
Laura is the owner at Navigate Wellness. A couple different locations. We'll get all that stuff in the show notes. But super excited you're here. Very excited to talk about some of the things that I know are coming in your specialties that we're going to talk about. But I always start with, how'd you get into the profession? What's the history that brought you here?
Oh, this is like such a long, convoluted story, but the thing I often tell people, or how I actually started, was when I was like 6 years old. So my parents were cuckoo, or they still are actually. It's not changed, but they were born again Christians.
Hmm.
So again, I grew up with a lot of bizarre religious stuff floating around me.
Yeah, I can relate.
Yeah. Um, they later turned to Wells, but they started off as born again Christians. And I remember in the kind of church that we grew up in there, they baptized children when they were old enough to bring Jesus into their hearts. And I remember that when I was 6, the pastor baptized me and they gave me a testimony.
Hmm.
And so when I was a little girl, they said, angels would come and speak to you about other people's pains, and you would hear this, like you would be able to like communicate, like angels would come to you and talk to you about other people's pain. So now again, like as an adult, I recognize like how crazy this was,
Yeah,
but as a little kid I was like, I'm gonna know about people's shit, like I'm gonna hear about people's shit.
yeah.
But that was like the first little breadcrumb I got about like being able to like connect with people and stuff like that.
Hmm.
And then there was like so many other stories or incidents throughout my life that like just guided me towards like, I don't know, connecting with people, or just like, I don't know, listening to people, being an empathetic, person,
Sure.
connecting with people. I remember there was another incident or event in my life where I remember maybe being about, I don't know, 11 years old and sitting in a doctor's waiting room. And my mom had told me like consistently that this waiting room that we were sitting in was my sister's dermatologist.
Hmm.
And I was like, okay, so, but I was like, why are we coming every week? Like, that seemed kind of strange or bizarre that we were coming every week to this dermatologist. So one day, as I'm sitting out there, my mom and my sister would go into this dermatologist's office. And this one day in particular, the doctor came out of the office and he like bends down and he comes and he's like, can you come inside the office with me today? And I was kind of like weirded out by this, but I was like, okay.
Hmm.
So he pulls me in, he starts asking me some bizarre questions, and like I start to like realize like this guy's not a fucking dermatologist, like who is he?
Sure.
And he's like asking me questions about my dad and my sister and like all this
Sure.
stuff.
So not about your skin at all.
It's not about it's not about skin at all. And after he asked me a few kind of weird questions, he goes over to his bookshelf and he hands me this giant blue book, huge, heavy blue book. And I look at it and it's like the book of psychiatry. It's like this giant book of psychiatry. He hands it to me and he says, you're gonna need this one day.
Oh.
And like, ugh. Like what the fuck? And it comes out that my sister, who had actually been going to this quote dermatologist, had been going and seeing the psychiatrist for months. And my sister had always like had kind of mental health issues.
Hmm.
And my dad was diagnosed bipolar 1 disorder. Like my family is like riddled with mental health issues.
Sure.
But it was like this like moment in my life where I'm like, oh, I'm gonna be like called to do this, working in this field and industry and stuff like that.
Sure.
So there's literally been like all these like weird things that have like led me to this
Yeah.
field in this career.
Yeah.
So I could go on and on and on, but those are like the two very specific stories in my life that like
Sure.
stand out.
It's very specifically not how to do mentorship. Here's the DSM. You're gonna need it. So what was school like for you? Like, did you go straight psychology? Did you know you wanted to do like therapy specifically, or was that kind of a meandering journey once you got into higher ed?
That was also a meandering journey. Like I went to Mount Mary, and again, that was like a weird happenstance. Like I did really like poorly in testing in school. Like I'm dyslexic, and I
Hmm.
just did not do well in school
Yeah.
academically. And I remember my guidance counselor said to me in high school, like, you're not going to really make it in school. So I had ended up getting this like weird scholarship through my grandma's I don't know, something through my grandma. And it was like, I don't know, $1,500 scholarship, which again, back then literally covered books in school.
Yeah.
And through this scholarship, it was like you can go to any of these schools in the Milwaukee area. And one of them was Mount Mary College, and they
Hmm.
had like an interior design program. And I was always like a creative person. I did art, and that was something I was like, oh, Mount Mary, it's close by. I could go there. I could, do art. So I got into Mount Mary and I started doing interior design, and I was like minoring in psychology because I
Sure.
still really enjoyed that.
Yeah.
And the first year I was doing it, in December of that year, my dad got into a really bad car accident and was in a coma.
Hmm.
And so I go to my interior design like instructor and I ask her for more time to finish my project, and she said no. And I was like, my dad's in a coma. And I think she thought I was like kidding. Like it seems like a pretty like crazy thing. Like,
Yeah.
can I have more time in my project? And she was like not compassionate at all. And I decided to drop that program and just continue on with psychology, or behavioral science was kind of the
Sure.
undergrad.
Yeah.
And so again, it was like this like weird like pivot.
Yeah.
And so then I just pursued doing psychology and then just kind of kept rolling with it.
Yeah.
So it was just this like weird thing that just got me out of interior design to do
Yeah.
therapy.
And now you run your own practice. So what was that journey like getting into the field? Did you do like agency work? Were you at like a hospital or healthcare setting, or did you like know you want to do private practice? Like I'm always curious now owning my own practice and seeing how much time I wasted in agency work. I'm curious how other people get here because I think like I don't want to say it's the gold standard, but like from a work-life balance, I think it's really nice to be
Yeah.
a private practice owner. So what was that part of your career like?
Yeah, I always like think I always knew I didn't want to like work for anybody. I always knew I wanted private practice. Kind of, I didn't know how I was going to get there.
Mhm.
I started out in like Department of Corrections, working for the Chapter 980 program, which is sexual violent criminals.
Mhm.
So I knew I kind of like criminal, like I kind of like law enforcement and criminals. So I started there as an undergrad, actually as an intern, and it was like kind of the first undergrad intern that was able to do that. So it was kind of a really exciting thing for me.
Yeah.
Um, then I kind of went into county work. So I worked for the county for a while, did some of that work. Um, I'm trying to think again. I feel like I've been doing this for so long. Like, where else did I go?
Yeah.
Did that. I really, I guess, through working through many systems. So doing that, I did do private practice for a while, like kind of like right out of school.
Mhm.
But I always like found myself like not working really well in systems. Not that I couldn't work well, but I was always the one being like, this isn't working. This isn't working. Like, let's find a better way. Let's find a better way. Like I
Sure.
hated 50-minute sessions. I hated diagnostics. Like I just everything that was like in the box, I like wanted to get out of the box kind of thing.
Yeah.
So it was through a lot of a lot of system work that I realized like I couldn't do it anymore. So in 2014 is when I was kind of like moonlighting basically in private practice. Like got my own LLC and I just started like a night here, a night there, on a
Sure.
weekend kind of
Yeah.
thing, and just started slowly like building my practice
Yeah.
till I felt like confident enough that I could get enough clients to
Yeah.
fucking leave.
Yes, very cool. So you talk about being dyslexic, and you and I have connected in the past about being ADHD. What was that like? Being in the profession, did you have these diagnoses while you were in school, kind of growing up, or were these things that you kind of learned later? Like, where did that fit in the timeline?
I always knew I like was, I don't want to say off, but like I always knew there was something probably going on.
Hmm.
But I always like navigated it. Like I was always I think it wasn't until I think there was like this aha moment I had when I got to high school. So I grew up in Milwaukee and I went to a small Lutheran school, and I was always able to like I'm like embarrassed to admit this, but I was always like able to like cheat my way out of like everything in a
Sure.
sense. Like we literally, the school that I went to, it was kindergarten through 8th grade, was 80 kids. It was so tiny, and if I needed to like figure out a math assignment, I'd be like, hey Nicholas, like what did you get for number 8? Like I was always able to like figure stuff out
Yeah.
through manipulation. Because again, I struggled in some areas.
Sure.
I was always very creative and everything, but
Yeah.
when it came to certain top like math and those kind of things, I just really struggled.
Hmm.
So when I got to high school, my parents, we moved from Milwaukee to Mequon.
Yeah.
And so I had to go from that little and tiny bubble of an environment to Homestead, which those of you who are in the area will know. It was like this huge culture shock. And I got to high school and I was like, fuck.
Yeah.
Like, I don't know what the fuck I'm doing. And I was so far behind. I remember like basically having to retake so many classes because I was so far behind and like realizing like, oh, okay, like there's a problem here. Like I have a learning disability. Like
Yeah.
I had to like take pre-algebra like many times to like catch up. And so that was like the first time that I was like, ooh, like there's something going on here. And then throughout like again, just like educating myself and like now throughout the years of like me being an adult, like realizing like, oh, like I have some of these like things going on.
Yeah.
So, but again, I think as humans, we're really adaptable. Like we're so adaptable. And I think that's why too, like as a clinician now or as a therapist, I realize like this, I'm actually so grateful I didn't get a label when I was younger. Like that, I think the label would have again put me in a box and I wouldn't have figured out how to like meander through life or navigate
Sure.
life in a sense.
Yeah.
I know sometimes getting the label helps people get resources, but for me personally, not having a label actually like helped me figure out life in a better way.
Yeah.
Or adapt in a better way.
Yeah.
So I think that was helpful for me.
Yeah, for sure. That's interesting kind of as I'm reflecting on my own story because I did not get my diagnosis till I was in my post grad. Which like that's useless at that. Not that it's
Yes.
useless, but like, I've gone through all the hard school
Yes.
at that point. Um but I went into a therapist and said like, "Hey, I have ADHD. I just need you to test it so
Mhm.
that I get the official diagnosis." And that was fine. That's not at all a good way to do therapy, but so I knew it at that point.
Mhm.
But like, I look back at my private school because I was raised Lutheran, and I do think there are things that it would have been nice to have the awareness. And like, it was so apparent. I was always on my desk. I was that kid who sharpened my pencils every hour. I was the kid who
Yes.
clapped chalk at the old school chalkboards and went outside and clapped the erasers together because we had to get the dust off of them. Probably have like emphysema or something from that in my future. Whatever they used for those blackboard chemicals. I took the flag up and down every day. Like I had all these extra jobs because I was so far ahead in my work.
Mhm.
I had good grades, but like I could not sit still for
Mhm.
8 hours.
Mhm.
So it was one of those things where like I think in private school, they don't have to have resources. They
Correct.
don't have to support students. They don't have to deal with an IEP.
Mhm.
They don't have those resources available, and they are not legally obligated to follow through with them, which is problematic. But yeah, I think not having that label, you do adapt. You do learn how to get through it. I was a good student, and I still cheated because it was available.
Very, very easily.
In a smaller school, I think maybe we had 25, 30 kids in my class, and
Mhm.
I'm the youngest in my family, so I'm bad at certain things in algebra
Mhm.
because one of my sisters saved one of her algebra notebooks,
Mhm.
and so a friend of mine and I just copied
Mhm.
the answers,
Mhm.
and we only did the ones that they got wrong, so we got good grades, and then we failed all the tests because we didn't know how to do anything. So it is weird. I relate to a lot of that. I'm curious because dyslexia and ADHD are both under the umbrella of
Mhm.
neurodivergence, which I think a lot of people think autism spectrum and ADHD and neurodivergence, but
Mhm.
we know dyslexia and the other forms of it, dysgraphia and I don't know how to pronounce them all. I don't work
Yeah.
with the learning disabilities too much, but it's a processing issue
Mhm.
where your brain doesn't process the information the way that other typical brains might process it. Did those things get combined for you, or were those kind of like two different things that happened in your life of like, oh, I'm dyslexic, and then at another point in your life, like, oh, I'm also ADHD.
It kind of happened separately. So
Yeah.
I was one of my really good friends who I've known for probably 12 years now. She's a nurse practitioner, prescriber. She was the one who kind of more pointed out the ADHD stuff or ADD stuff for me.
Hmm.
And she was just like, why don't you just try some medication? She's like, I think that this might be going on. She's like, just try it. And I was like, kind of against medication. Like I was like, no, like I don't want to do the med thing. Da, da. She's like, just try it. Just see what happens. Let's just see what you notice. And I was like, fine. And so it was right after I had my first son,
Hmm.
who is now 14. I remember she had prescribed, I think, Ritalin or one of the kind of stimulants of like immediate release. And I remember me taking it. He was maybe about 8 months old. And it was the first time I felt like my mind was able to just like be calm. Like I felt calm. I was able to take him on a walk and I didn't have anxiety. And I was like my mind was still. Like I
Yeah.
was like, holy fuck. Like I was like, is this like I couldn't even comprehend it. I was like, is this normal? Like, I was like, holy shit.
Yeah.
So it was like this mind blowing thing, which again, like I had been so used to like people talking about taking stimulants, like, oh my God, like again, I went to Homestead. So like everybody that took stimulants was were just fucking abusing them. Right.
Right.
And so again, the paradoxical effect of like being like, wow, my thoughts are calm and I don't feel anxious. And I'm actually feeling, I had more of a flat affect actually when I took stimulants. I was just like, like, right. And I could slow my stuff down.
Yeah.
So that diagnostic understanding came later on where the dyslexia stuff was like, oh, and dyslexia runs rampant in my family. My mom has dyslexia, my uncle had dyslexia, my older sister has dyslexia. So
Yeah.
again, I was like, well, duh. But again, I think because my personality was, I think my personality was actually the thing that like kind of was distracting everybody from the learning disability, if
Sure.
that makes sense. Like I was always like this kind of like bubbly kind of, so I was like distracting everybody from like kind of this thing that was going on of like some of my comprehension stuff. Like I remember again being in math and being able to like, I would read like word problems and I'm like, I can't fucking understand what they're saying in this word problem. Like I could not comprehend it.
Right.
And again, I think if I had the right teachers or again some of those right resources to help me work through that, I would have been fine. But again, I was just like, I don't know, fucking 4 ducks and now 3 are gone. Like I couldn't, my brain just could not process the information. So again, now as an adult, I'm like, thank God I don't have to work out these word problems. But but you learn. But now again, now that I have my own children, it's like, being able to kind of step back and kind of see like, okay, where might some of their struggles be as I
Sure.
see some of their educational things coming up. So
Yeah, isn't that fun?
it's super fun.
We could talk about parenting too. It's my 5-year-old definitely has ADHD. Probably my 2-year-old too. So okay, but I'm gonna back up a little bit. I always just kind of follow my own curiosity in your podcast. So then, where does starting your own practice versus having kids fit together? Because that's not extra, but like that, those are different things to balance that I think people don't always consider.
Mhm.
Like we in our society separate work and personal life so much, but when you own your own practice, something like being a parent is a really big deal, and trying to navigate being a business owner, starting a practice, running a practice, whatever, versus like having a toddler versus a teenager are very separate thing, are very different things.
Sure. So I'm crazy, and I mean, literally, I think this is where again I'm kind of like appreciative for I think some of my ADD. I'm able to kind of like diversify. I mean, my husband would probably disagree. He's probably like, but I literally was pregnant. I was pregnant walking across the stage with my undergrad, and I was pregnant I didn't even actually walk for my master's degree.
Either.
Yeah, I was like, fuck this shit. I didn't even walk for my high school diploma. I didn't give a shit about any of that. But I was pregnant with my undergrad. I was pregnant with my master's in my gown.
Sure.
So like to me it was like never a question. Like I was like, of course I'm gonna do that. Like there was I know this sounds probably bad, but it was like having children was never gonna be like, oh, I'm gonna pause this stuff to have kids. It was just like it was going to happen.
Sure.
It was going to happen in conjunction with each other. So it's been really hard. It's been really difficult, but at the same time, too, like I wouldn't have it any different. Like I'm so grateful that I had children really young. Like I had all 3 of my kids before I was 30. So like, thank God I got it out of the way so I can kind of keep moving.
Sure.
Again, that's, I know not everybody does that or can do that or whatever, and that's fine. But like, this is just what has kind of unraveled in my life. And like, I'm super grateful that it's kind of worked out that way.
Yeah, I think that is one of the perks of ADHD is the more stimulation in your life, like the more mellow you are.
Yeah.
That's why we treat it with stimulants.
Mhm.
I don't take medication. I never have. Not that I'm wildly opposed to it. I'm opposed to medicating kids, I guess. But it's one of those things where like I'm very much self-medicating with caffeine, which is stimulant. And so it's one of those things, but also managing it through life choices. And so having a lot going on. I was teaching and coaching and doing therapy. Like that's crazy. That's a recipe for burnout. But when you have ADHD, like, no, I'm good because I have so many things going on. If I have too little going on in my life is when I go crazy, not too much.
Well, and to your point, I mean, I think going back to the stimulant thing, like again, there has been pockets throughout the last, 15 years that I'm like, okay, I'm going to go back on the med and try it for a little while. And I stop it because I don't like feeling like I've used it, I think I've used my ADHD or ADD to kind of propel me in life, right? I feel like I don't like how it actually makes me feel. I like not feeling like all the racing stuff going on, but at the same time too, I'm like, I get more shit done when I'm not on meds. So I tend not to be on medication because I have functioned longer in my life with it than without it.
Yeah.
The ADD.
Yeah, same. And and that's not to besmirch medication. And I think
To each their own.
yes, for people who need it, it can certainly be life changing. But there is all. I don't know. I've been doing this for 15 years. I
Mhm.
can't think of a case off the top of my head that there hasn't been any trade off. Like the
Uh,
medication is always a cost benefit analysis. If
mhm,
you're in higher ed, you're in school, you're a student, and
mhm,
you are struggling,
mhm.
like yes, it can be life
Sure.
saving. But like for us at this point in our careers, we have a job that's very flexible.
Mhm,
We have a job that's highly stimulating. Like probably don't need medication,
mhm.
or there are things that you can adapt through. Organizing things in your life and diet, nutrition, exercise. Like there are other things that you can do. We tend to be the only country that goes medication as a first option instead of kind of ruling out some other options
Yeah.
first.
And again, I mean, I would identify like my practice being a more holistic practice. Like I have my certification in holistic health and like that kind of thing. So I do like to explore things that are more holistic and like how do you fit your actual lifestyle to work with what you're dealing with rather
Right.
than just like med stuff. I think again, sometimes it's an interesting thing to explore it and be like, again, for me to have that moment, be like, holy shit, like this thing really has like I think it's a good test, especially with like ADD and stuff like that, to use a stimulant to test to see if is that really what's going on in your brain, right? That's a curious thing, but it doesn't mean that that's the only tool that you have. So,
Right. Yeah, exactly. Yeah, cool. Let's segue because you brought it up. Let's segue into some of your specialties because you've been doing this for a long time and have accumulated a bunch of them in the classic ADHD fashion.
most listeners are like,
Because I have that too. Mine are super disconnected. So I was like, and in case you didn't pick up, I'm also neurodivergent. So yeah, let's talk about. You don't have to do all of them. What are some of the things that are kind of you're focusing with your clientele and your caseload currently?
yeah, so like the holistic stuff is definitely I really love to explore how like vitamins and nutrients and kind of like that stuff really enhances like input output, right? Like so,
Sure.
I really value that. I like looking at people's nutrition as part of their health.
Yeah.
So I'm like sitting here, I'm like, okay, there's a certain letter, like designation for it. It's like certified integrative mental health professional. I think that's what it is. But to be honest with you, I could be wrong on that. But it's
Sure.
CIM, blah, blah, blah. I don't really give a fuck. But there's something about that
Yeah.
integrative mental health professional.
Yeah.
So I try to incorporate that somehow, right? Like, okay, do you have enough fucking omega-3? Like, do you have enough vitamin D? Do we have some of these just fucking basic essentials in your system? I
Right.
think it's so important, and not enough mental health professionals look at that. Like,
Yeah.
I think it's actually if I could encourage more mental health professionals to get more educated on that and integrate that in their practice, I would encourage them as much education as you can.
Yeah, and I come at it from a totally different perspective, but land on the same place because I come from a sports background, and so that idea of your nutritional food as fuel
Mm-hmm.
makes so much sense to me.
Mm-hmm.
And then we've researched too, like what was it, 2019, 2020 maybe, where folic acid, which is vitamin
Yes.
B9,
Yeah.
has like a reduces suicidal thinking by like 44%.
Yes.
Like simple over-the-counter supplement
Yes.
that people can get. You get it from your food, but most Americans don't have a healthy diet and are lacking lots of nutrients and vitamins. So something like vitamin B9 or like vitamin D, we're in Wisconsin dealing with something like seasonal affective disorder. Like there are people who need to take 1,000 times what is recommended
Yeah,
for
like
your daily dosage.
50,000 IU's per week, and it's like, yeah.
But that's because like they're so deficient in it. And so again, like yes, I wholeheartedly agree, and all these different kind of ways that you can get to that, looking at it like yeah, our brain is part of our body.
Correct.
And to separate it and say mental health is different than your physical health doesn't make any sense because what you put into your body is fueling your brain as well.
Yeah, and I think again, sometimes it's like even if you can get your clients to yourself and your clients to just have awareness. It's like okay, just for the next fucking week, write down what you eat. Do you wake up and you're again, I am a caffeine addict too. So like, how many cups of coffee have I had today? But like, yeah, when's the last time you sat down and had a fucking piece of broccoli? Like that kind of
Right.
stuff. It's like just awareness, I feel like is huge. So I try to really integrate that. That's kind of one of my like little passions.
Sure.
I do EMDR. I feel
Mhm.
like that has been really that was like a huge shift point in my practice. Is again I went from like kind of more of I wouldn't all fucking therapists are trained in CBT. But when I went from like more talk therapy to using EMDR, it was this like very powerful tool.
Yeah.
And I now use it and implement it in as much of my practice as I can. And again, I would say this won't be shocking, but I don't use it in like the traditional EMDR way. Like there's like these 8 phases and this, that, and the other. And like
Yeah.
you use it in this very structured way. Not that isn't used, or I don't, not that I don't use it ever, but I use it in a lot more of an organic way in my practice. But so I do EMDR, eye movement reprocessing and desensitization. If people don't know that,
Yeah.
EMDR stands for, but it's a really powerful tool to kind of, again, especially for people that have like PTSD or have had like kind of traumatic events happen in their life, or people that don't love talking about their feelings and emotions, like people that
Yes.
really have a hard time like accessing or verbalizing what they're experiencing. I work a lot with men that are like, first responders, vets, that kind of thing.
Yeah.
They don't want to sit there and fucking talk about their emotions and stuff like that, but it helps them access these kind of really traumatic things without necessarily talking
Yeah.
about it.
Can I, because I've had a lot of trauma specialists on because I work with religious trauma, and I'm curious kind of what got you interested in that. Was it being in the profession and seeing all these people who had trauma and being like, what the fuck am I supposed to do with this? Or was it something that you were like, how'd you get there? Because EMDR isn't something we learn in grad school.
Mhm.
Trauma in general isn't something we learn in grad
Yeah.
school. I think a lot of people walk around. I did it early in my career thinking I was trauma informed and real, and like once I got into studying it, it's like, oh, I didn't know what the fuck I was doing.
Yeah.
So it's something that's kind of like there's an awareness to it, but how to work with it, we don't cover in any sort of depth in our
Mhm.
training, and as far as formal education for grad school would
Mhm.
be considered.
So yeah, it was something I wasn't like aware of at all. But when I worked at the county was like, okay, we want to send a a therapist and a caseworker to go get this EMDR training. And I was like, sure. Again, AD. I'm like, what
Yeah.
are we doing? How much? How much is it?
You're paying for it? I'll do that. Yeah.
I was like, yeah, of course. Like I was absolutely like, I'm bored for learning something new.
Sure.
So they sent me to the training nearby, and I was, learned about it, and I was like, this is fucking phenomenal. And then of course, like I look back at all the people that I had. Like again, I went back in my mind. I was like, dude, all these people that I worked with in the chapter 980 program and all this stuff. I'm like, fuck,
Right.
all the people I would have like treated differently, or whatever, or I would have, you know use this technique instead. I was like, Jesus, like it totally informed my practice moving forward, like
Yeah.
completely fucking differently. So really, it just was like, I think that was also the shift in being like, I gotta get the fuck out of here, like gotta get the fuck out of the system, because it really, like again, perfect example, insurance companies will only typically pay for a 50-minute session. EMDR, like you need way more fucking time than 50 minutes to do EMDR. So it was kind of this thing, I was like, I can't use this tool in a 50-minute session. Like, so again, it was like this, everything started like shifting once I got trained in it. And I think I got trained in 2016. So that was kind of the first rumblings inside of me of like, all right, and then of course, then my brain like exploded of like, okay, we're getting into, subconscious processing and like all this, the body holds the score, all that kind of stuff. And like, and again, I'm a cerebral person, I'm a thinker. So again, I was like, oh, how the fuck do I get out of my head? Right. Like, so that was kind of like, that's the main one I got trained in. And then I don't know where you want to
go. I do want to go someplace.
I can see your face.
No, you've recently added. But I do want to take a pause to just say, like, yes, one, I think when you're actually trauma informed, it's so hard to look at a case and not see the trauma. Because I've written about this somewhat extensively, that like everyone has trauma. And there's big T trauma and little T trauma, big T being kind of what we think of as PTSD. Those are people, first responders are a classic example that I use as well. Like people who have gone to war, people who have seen, these horrific things, like our body processes that as well as our brain processing that. So in order to work through those things, we need something that responds to both your brain and your body. But even like, I look at the couples I worked with early in my career, because I'm a marriage therapist, it's like, man, there's so much trauma in there. And like by not responding to it, I could give them all these skills and all these tools, but like spinning wheels, because if we're not addressing the trauma, it doesn't work. So it's wonderful, and also, yes, like maddening as a therapist to look back and be like, what was I doing?
You miss so much. Yeah.
And some of that's systemic, because like you early in your career working with something like sexual assault, like that's this wildly complex, highly intense topic. My internship was at a homeless shelter. I'm doing like mindfulness stuff, which like is wonderful.
Sure.
I speak very highly of mindfulness, and absolutely not what the people who are at the homeless shelter needed from me.
Well, okay, so two things on that. So yeah, that first internship, it was working with the offenders, right? It was working with the offenders. And again, everyone's like, how could you work with the offenders? I'm like, again, you listen to their stories and you always found out 98% of the time they were sexually they were
Yes.
perpetrated
It
against. And again,
isn't.
right, you follow the trauma. Everybody has it. And so
Yeah.
I think too, one of the things that I've tried to use in my practice more, instead of using the word trauma, I use the word impact, right? Like everybody's been impacted. And I love in somatic work, they talk about like you're like a ball of dough, right? And like everybody gets needed, and this was needed, and this was needed, and this was needed. So
Yeah.
it's impact, impact, impact. And then you have this fucked up ball of dough, right? It's like
Right.
it's like all of us have been needed into this loaf, right?
Yeah.
And then you put it in the oven, you're like, what's gonna come out, right? And so again, it's like this visual of like, man, we've all fucking been impacted. And sometimes you have to take the word trauma out of it, I think sometimes, because either people look at it and they're like, oh, you weren't really traumatized. I was traumatized. You weren't traumatized like I was traumatized.
Right.
It's like, but we've all been fucking impacted by the things that have happened in our life,
Yeah.
right? All of our dough has been fucked up in some way.
Yeah.
So
Yes. And I think, yeah, I talk about this with a lot of the guests that I have on, like putting therapists who do not have the skills or tools in these high intensity situations leads to burnout.
yeah.
And also, like, oddly leads to underserved populations because us therapists who have been doing in the game for a long time aren't seeing those high intensity populations because, like, the system isn't set up to have any resources for them. So for us as practitioners to pay our bills, we're not taking the low level insurance. I don't take insurance at all. So it's like it's these things where it's like I'm aware there's a need, and also the way our society has just decided, well, like, oh, they're homeless and poor, so they don't get resources, or we'll send them an intern who has no training to be able to help them with things like trauma.
Yeah.
I also tend to get on this soapbox every once in a while, but like, and it's not something I worked with a ton, but as a family therapist, seeing a lot of situations of abuse, like, right, it's an uncomfortable reality for a lot of people because we want the black and white thinking of people who hurt people are bad people.
Yeah.
But the reality of like most perpetrators are victims themselves. Like, how do you support victims and be against perpetrators when most perpetrators are victims? So it's messy. Like,
It's
it
so
definitely moves
messy.
things into a gray area instead of what people want for like a very black and white, like bad people do bad things and they go to jail. Like, that's not at all how the system works.
No, and you're right. I mean, I think that's where so many people were like, "Oh, I can't believe you did that." But it's like, I think if I wouldn't have had that experience working with the sex offenders, like I think I emerged from that, like being able to sit with anyone
Yeah.
and have compassion. Like I always say to people, like when clients have shared things with me and they're full of shame and they're like, "Oh, here's my shame," and I like literally can look at them and I'm like, they can tell like I have compassion, I have no judgment, and they're like, you're not upset about this, or you're not judging me," and I'm like, again, in the back of my head, I'm like, I've worked with these folks. Like,
Right.
I don't have to judge you, right? And
Yeah.
they can sense that. Like, there's an authenticity about that. I'm like, I don't have to judge you. Like, that's not my job here. It's unconditional positive regard, right?
Yes.
So,
Well, and it's a normal Tuesday for us for the most part. Like I think
your shame.
I think clients can't hold on to these things thinking they're so big and bad. And like for us, especially when you've been in doing therapy for a long time, like we've heard it. Like for, I don't know, probably 5-6 years into the profession, I was already telling people like, you can't tell me something I haven't heard of already.
But I also think like the work that I feel like I've done myself, and the work I continue to do with myself is sitting with my own shame, right? Sitting with my own shame and working through the stuff that comes up in me, right? Like, I mean, again, as therapists, we're still human. We're still human dealing with our own human experience. And again, it kind of reminds me of that the religious trauma stuff. Like, I've grown up in the born again Christian community, in the Wells community, Lutheran Wells community, and I felt like one of the things that molded my dough was like original sin. You are sinful from birth, and I was like, fuck, I'm bad. I've grown up with shame my entire life and having to bring that to myself all the time, be like, oh my God, I'm full of shame. So the work I have to continue to do with myself is, I think, present and authentic in my relationship with my clients. So
yeah, for sure. And I think again that unconditional positive regard, like it's a space I think we professionally hold, but like there's effort in it as well. Like there's work that we do as professionals to be able to hold that space for clients. It doesn't just like magically happen. But it's also hard to explain to clients because I think when you're not used to occupying that space, it seems very foreign.
Yes.
And we're used to occupying that space. So like it's a thing that's practice, there's effort, there's work that goes into it, there's work to maintain it, because certainly therapists burn out. I think current research says more therapists are leaving the profession than coming into the profession. So like we don't do a great job overall, maybe of self-care, but like trauma informed. A lot of the guests I've had on the podcast who work with trauma, like, no secondary trauma. We're taking things in as therapists, and we need to work on it as well. Where I want to shift is one of your new things, because you are certified to do ketamine assisted therapy.
Yeah, actually, it's a perfect segue because I one of the things that I really want to try to start working on in regards to utilizing ketamine. So, the again meandering thing of ketamine. At first, when I like heard about utilizing ketamine in therapy or in a clinical setting, I was like, "What the fuck?" Like, what I remember from ketamine when I was like in high school was like K holes and like
Yeah.
that kind of stuff. I'm like, "Oh,
Special K, those
Special K, yeah,
street drugs.
yeah." Like some of my friends were into Special K, and yeah,
Homestead.
yeah, Homestead, exactly.
That's a geography joke for people who maybe aren't from the Wisconsin area. Because Mequon is maybe 10 minutes outside of Milwaukee, but it is a much more affluent
Uh-huh.
part of town. And Homestead's a huge school. So I'm not saying everybody who goes there is affluent, but I'm saying it's a different vibe than being in Milwaukee proper, even
Mhm.
though it's 10, 12, 15 minutes away.
Mhm. Yeah. Nice cars, lots of drugs.
And yes, there's some reputational things about, maybe the inner city kids are smoking weed and the kids out in Mequon and some of the surrounding areas are doing much more designer drugs because they have money.
Exactly. So yeah, when I had heard that people were using ketamine as
Hmm.
in a clinical setting, I was like, what the serious fuck? But then I started kind of educating myself on it, and then it was like one of those things where it's like it happened, like synchronicity, where like you're hearing it there, and then I heard it from here, and then I heard it, and you're just like it's here, you're hearing it pop up, and then I was like, oh, now I'm curious. Now I want to start educating myself on this, like whatever. Um, so really ketamine is a dissociative anesthetic that they use like, again to kind of put yourself under, or people use it in like surgical settings to like um before you go into surgery and stuff like that. But what they're finding clinically speaking is that it's really good for people with like depression, PTSD, suicidality and stuff. And it basically causes your brain to go in a neuroplastic state,
Hmm.
right? So when used properly, when used in a clinical setting, you can kind of get a person to kind of go in this. It's like a liminal space, basically, where your brain kind of goes in a dreamlike state, and you can kind of traject yourself out of depression pretty quickly.
Hmm.
But when you pair it with therapy and you pair it with like prep session. So the way I do it in practice is we kind of prep a client, right? Again, the appropriate client,
Right.
because there's a lot of appropriateness to it. You prep a client to do like set intentions and such like that, and then you utilize the ketamine, and then we do something called integration sessions, where you're taking the information that came out of the ketamine journey and you're integrating it then afterwards. And I like to use actually EMDR and stuff like that afterwards to
Sure.
integrate that information thereafter. It can be a really effective kind of treatment plan.
Mhm.
So what I am really excited about using it for, again, I kind of said like I work with like first responders, police officers, veterans, and stuff like that. Is you're finding people able to work through some of that trauma stuff, which is like huge for some of these populations.
Mhm.
And what I get really excited about is using it with therapists that have vicarious trauma. Therapists that have like, again, they're sitting in office all day long hearing this stuff and they don't know how to release it, right? Like we're kind of our worst, our I don't know, our worst enemies in a sense. Like we're sitting there, we're taking it all in and we don't know how to release it. Like we were talking before this, but like I was just at a conference and a lot of it was talking about like we're sitting there all day and we talk all the time about self-care, but like we're not coming up with any new ways of self-care. It's just like, oh yeah, go take a walk between clients, or
Right.
go do some breathing techniques between clients, but we're not actually like releasing all that energy.
Hmm.
So ketamine has actually been a really effective tool of like how do you actually take all that heaviness that we've all been carrying and like how do you actually release it and like transmute it in a sense, if that makes sense.
Yeah. Yeah. And I think one of the things that's fascinating is because I'm coming from a religious trauma perspective, and psychedelics are very exciting in the religious
Hmm.
trauma and just trauma in general, because some of the response, the brain chemistry changes, and some of the things that get unlocked or opened up, or pathways that are available to the brain
Yeah.
when it is in an altered state.
Yep.
And so, that dissociative effect of ketamine is what's helpful. Why it happens in a clinical setting is different than what somebody who's going to see, an underground punk indie rock show in Brooklyn is using ketamine for. Like, those are different things. So the clinical setting is different, but it creates space where the normal brain patterns aren't happening. That's not firing automatically.
Correct. So what they noted, I mean, yeah, so you're going into these non-ordinary states of consciousness, and what they're finding with ketamine is it's like basically the part of your brain that feels very helpless, right? Like you're let's say you have depression, and you're just like you have this like learned helplessness feeling or sensation or hopelessness that when you're going into this journey state with the ketamine or any kind of, I'd say most psychedelics, you're coming out of it, and that learned helplessness part of your brain is being blocked.
Hmm.
And that, again, for somebody who's been struggling with that helpless feeling, for that to go away for a while, holy shit, how powerful that is, right?
Yeah.
Or, again, I've gone through my own ketamine journeys now because, again, it's kind of recommended for people. Same with EMDR, when you're trained in EMDR, they want you to have your own EMDR experience. So you can kind of inform your clients, like, these are some things you can maybe expect out of this journey.
Right. For sure.
I remember my first ketamine journey, it was like I emerged out of that experience with a level of gratitude I have not felt in fucking 10 years, right?
Hmm.
Like it's like I've accomplished a lot in my life. I've had a lot of success. I've had a lot of like things that like logically and cerebrally I know. Like I'm like, wow, I'm really grateful for this. But the feeling and the sensation of gratitude had been missing for a really long time. It was like I couldn't access it. But then after the ketamine experience, I was like, oh my God, I can feel it again in my actual body. Does
Yeah.
that make sense? So it was like I almost was like I needed to like touch it again
Yeah.
in a way. So again, it was really powerful, and it was like that lasted for quite a long period of time after that journey, and it was
Yeah.
like something my brain needed to remember again.
Yeah.
So again, that was kind of like a really cool experience.
Yeah, and it's fascinating again with something like trauma, where your brain goes into survival mode and it starts blocking some of the communication that's coming from your body, and
Mhm.
so and then people get in the habit of intellectualizing, which therapists definitely do. Where they're not only are their brains blocking what their body's telling them, but they're thinking, so they're just feeding their brain
Yeah.
and totally ignoring the body aspect of it.
Mhm.
So I think that's really huge. I do think therapists, because I work with a lot of mental health and medical professionals as well,
Mhm.
we do this weird thing where, like, because we talk about it, we check it as a box without doing it.
Yeah.
And so, like, oh, if I talked about self-care, like, that's good, but like forgetting to do it.
Yeah.
And then I also talk about a lot, like, self-care is the bare minimum. So, like, self-care is not the goal. Self-care isn't the end of the journey. Self-care is the minimum to be functional.
Yeah.
Like, where are you having joy? Like, what are your lifestyle choices that are healthy for you and enriching for you? Because if we're just going like, oh, this keeps me barely functional,
Mhm.
I do yoga once a week and that helps.
Yeah.
Like, you're going to burn out at some point. You're not going to stay in the profession, and you're not going to be doing great work for your clients.
Correct. I talk about this all the time with clients and just peers and stuff like that. Like so many people, I call this my con artist thread. So many people are con artists to themselves. They lie to themselves about what their authentic self actually wants, right? Or what actually feels fulfilling to them. So many people are like, yeah, I walk every day and I drink this water, and but it's all bullshit. It's like, I mean, not that those things aren't good for you, but it's not truly fulfilling to their authentic self. And so I think the way to get to your authentic self is being honest with yourself, right? It's like those things are not that fulfilling to you. Like you
Yeah.
do them because you're supposed to. It's in the system. And yeah, going back to that conference, like so many people were like, yeah, talking this game, but it was like, does that really fulfill you though? Like, I don't know. Like I can do yoga, but it doesn't feel that fulfilling to me, right? Or
Yeah.
whatever it is,
Right.
If it fulfills you, cool. But
Yes.
yeah.
Not throwing shade at yoga. I recommend
Yeah,
it.
oh, I love it. I do. But yeah, you have to really get so honest with yourself, and that is the part that like so many of us just lie to ourselves about what is actually fulfilling.
Yeah. And then I think to explain some of the jargon, which most people who listen to podcasts are therapists, but the neuroplasticity.
Yeah.
Again, our brains. The analogy I use is like if you go into your backyard, assuming you have grass in your backyard, and we're in the Midwest, so everybody has that. And you walk the same path every night, you're going to kill the grass there. Like you're going to wear a path down, and that's what happens in our brain with our neural pathways. The electricity runs the same pathways; they get very well worn. It goes quicker, so
Yeah.
our brain, which is this incredibly powerful supercomputer that's super lazy, just takes the easy route. And what happens with psychedelics in general is all these different neural pathways open up, and your brain is free to take them at the same frequency that the well-worn pathways would be. So it just opens up a lot of
Yeah.
things. When we see somebody who uses psilocybin, for example, the way that their brain lights up on a fMRI, like while they're tripping, is insane. And
Yeah.
there's so much brain activity that's going on versus when you're totally, fully conscious in a non-altered state that like these parts of your brains never light up.
Yeah. your brain's like, oh yeah, like I forgot about that part. Oh yeah, I forgot. Like this is where too, like the EMDR. I also do hypnotherapy, which again, some
I
people.
did before we started recording. I threw a little bit of shade at it.
But this is the way I look at it: EMDR, hypnotherapy, utilizing the ketamine, and I say this to my clients: these are just tools,
Right.
just fucking tools, right? Like we don't need to use them, we can use them, whatever, but they all access subconscious parts of us, right? They're all getting us to a place where we get to take our ego and move the ego out of the way, because our ego, again, we all have an ego, we're all gonna, it's all there, right? It's protective of us, but we need opportunities to move our ego out of the way to get to deeper parts of self. And those deeper parts of ourself hold really important information. So I think sometimes when our clients like realize it, or even ourselves, I'm like, God, if I could just get rid of my ego for just a fucking second sometimes, right? And again, that's where too, some of us really intellectualized, there's us cerebral people,
Hmm.
to get rid of it for just a little bit, it's like, like,
Yeah.
thank you so much. And
Yeah.
it accesses this deeper inner healer in us.
Yes, and not to shamelessly plug my podcast on my podcast, but I had Anne Hoddership, who's a certified sex educator, on to talk about um, why the love languages author was homophobic. But we talk about other things too, and sex education. But she does dream work, and that's something
Yes.
too, where like some of the things from like Freud and Jung and all those people, like I side eye it. I talk very openly about Freud being a terrible person for our profession, even though he's considered the father of psychotherapy. That like those things are lacking scientific backing, and so even something like hypnotherapy or dream work, I side eye it because I think there are people who abuse it
Sure.
or who take advantage of it because it is unregulated in the way that life coaches are unregulated.
Sure.
So like seeing someone who is a licensed therapist, there's accountability there that isn't there for life coaches. Not that like hypnotherapy doesn't work or isn't helpful to some people, but it's that I think as a consumer they are required to be so much more savvy
Sure.
in selecting some of those things, because you will get the same with like something like tarot, because I identify as atheo-pagan. So like some of the paganism spaces and wellness spaces, crystals and all that stuff, like there's snake oil salesmen in there. So it's not that these tools, as you're saying, don't work or can't help people. It's just that I think the consumer has to be so much more savvy.
Correct. Well, and I think again, even with, let's go back to the ketamine thing. Like anybody, like there are what I would call like pump and dump ketamine places, right?
Oh,
You
you
go
can
in,
get it online
yeah, you
too.
go in, you get the ketamine, you walk the fuck out. I mean, this is why too, like we try to, I mean, at least where I'm doing it, like we're going in, we're prepping, we're setting intention, we're doing the journey, you're coming back, you're doing integration. You need to, there needs to be some boxes, there needs to be
Right.
like there needs to be the appropriate regulation for it. There needs to be, I always say, like you have to do everything with intention, especially in this kind of work, right?
Yeah.
So yeah, you're right. I mean, the same with hypnotherapy, right? Like I think there are some but that's like that in every line
Yes.
of work. There are going to be some wackadoos, and there's going to be some like real people that want to do the good work, right? So
Right.
I think yeah, you have to be a mindful consumer. But that's in any setting, I think.
Yeah, and right, people who are doing DBT, which I love, can also do it poorly and
Yeah.
be harmful for their client. So, like, right, there is no hard and fast rule of it. I think there are certain things that attract the snake oil salesman or the con artists more because it's dysregulated.
Sure.
But again, that the profession gets better, and so it's one of those like paradoxical things where we're talking about ketamine, and both of us are super excited about it. And like, you got your certification, I'm looking at getting my certification. Like the science is catching up
Yeah.
to the way that it's working for clients. But it's paradoxical because people will look at it and say like, oh, well, that because they learned the propaganda or they heard about street drugs or whatever, and so they're like seeing this disconnect between the profession, but really it is kind of going about it with what's the research say, what's backing up. So it's not just anecdotal of like, my client went on a 3-day retreat and did mushrooms and came back and their depression was like, that's not what's happening.
Yeah, no. I mean, yeah, it could be happening for some folks, but that's not
It does
that's not the research that I think is showing right now
Right.
with some of the stuff. And I think too, like there is still so much yet left to like explore in this realm with psychedelics and ketamine
Yeah.
and everything. So, but it's been very interesting seeing it in practice right now. Just like some of the clients that like really truly like they've tried the SSRIs, they've tried some of this other stuff, they've tried to like release some of these like old narratives, and they haven't been able to release them. And the ketamine has really like kind of trajected them out of like some of these old like clung to narratives. And I'm like,
Yeah.
wow, that's pretty powerful. Even one of my clients in particular, they've tried the EMDR, they've tried some of these other things, and the ketamine really has kind of like that neuroplastic state has like pushed them out of that. And I'm like, wow, that is really cool for them, and I'm
Yeah.
happy for them.
Yeah, and it's fascinating, and I don't know the research on ketamine as well as I know the research on psilocybin, but it's fascinating to see something like
Mhm.
PTSD, which tends to be a much more chronic type issue, or treatment-resistant depression, which is, people have tried a lot of different
Yeah,
options and nothing's really stuck. Like the results that are happening with those populations
yeah,
is exciting.
yeah,
I would say is where the research is at. They're still working through what is time frame look like and how long does the benefit last, but like those are things where it's like we're pretty confident reducing the risk. It's not doing harm to clients if
mhm,
it's being used properly. It's just like, what are the long-term benefits of it? What does that look like for a treatment modality of, do you come back every 6 months or
yeah,
whatever? So some of that stuff's still being, I think, honed in. UW-Madison is one of the big research
yeah,
institutions, excuse me, for psilocybin right now, so like lots of exciting things
yeah.
there. And the reason these things had the bad reputation was because of bad science.
Correct.
Like it was all for political reasons and the war on drugs, and it gets back to some racism. Um, Good job, America. But it's
Thank you,
it
Mayor.
when we look at like, right, what a lot of us grew up on. Like I use my example I use a lot is my parents aren't neither of my parents are organ donors, and it drives me crazy. But they were raised in a generation of propaganda that they're going to take your organs before you're really dead.
Mhm.
And so like my mom has this irrational fear around like, well, they're gonna harvest my organs before I'm really dead, and then what if I could be saved and then I can't because I took my kidneys? And I'm like, that's not how it
Mhm.
works. But like again, some of the propaganda happens at this formative age where it's hard to work some of it out.
That dough just
Yeah,
being.
yes. But yeah, the same, that I use that example as kind of an approachable metaphor for people who maybe are hung up on like, ooh, but drugs, or I heard about this person who lost their mind on LSD or
Yeah.
whatever, and it's like, right, we're not.
Mhm.
This isn't some random dose that we're slipping in someone's coffee every morning, like Pink Floyd. And I love Pink Floyd. They didn't do drugs. That's what happened to their lead singer who wasn't with the band anymore. But it's one of those things where it's like, right, there's a methodical approach to this that's science backed, it's research backed. It's not just, and there are, the I forget what it is, but there's one where you just order your ketamine online and it
Mind
comes to your
bloom, yeah.
house and you do it by
Mhm.
yourself. And like I don't know, I have issues with that. I think
Yeah,
that's so hard. It probably helps some people, which
sure.
is why I can exist as a business, but the risk just goes so much higher. Whereas if you're working with a professional in a one-on-one setting and they're really tailoring their approach to what you're needing.
I think it goes back down to any of these things, any of these tools, like literally name any tool in the therapeutic realm. It all comes back down to the therapeutic relationship, right?
Right.
Like so again, and I supervise two women and two therapists, and I always say that to them. They're like, well, what can I do with this? Whenever we do supervision, they're like, well, what should I do here, and how should I do this here? What technique can I use here? I'm like, go back to the therapy. I can tell you 10 techniques you can use here in the next session with your client, but come back to your therapeutic relationship, like you said. Like so again, we're trying to use these tools to help our clients, and at the end of the day, if you have a strong enough therapeutic relationship with them, that tool will be pretty effective.
Right.
Right. So
Yep.
that's where I too, I'm like, I've been really trying to be mindful of like, even to like ketamine I would not use with all my clients, right? Like it's
Hmm.
very specific to which ones I would even offer it to, or the people that are inquiring about it now. I'm like, okay, like we would have to still see if you're first, right? I'm not going to just start doing ketamine on you. We have to
Right.
develop this therapeutic safety and alliance and
Right.
stuff. So I think that's where too, it's like, yeah, these are great things, but yeah, just giving you ketamine and then being like, good, like hope your journey goes well. It's
Yeah.
like, yeah, it's really about tailoring it. So
Yeah, as like you said, this is true of anything. Like I use breathing techniques as a good example from before I was trauma informed to when after I was trauma informed. Like there's really good research in science that breathing techniques help people.
yes.
But if somebody's trauma involved them holding their breath, if
It's
they
not
grew up
gonna
with a
work.
parent who was abusive and everything they do is tense and hold, like breathing technique is going to trigger them. And so you're
Yes.
not going to work through their trauma. You can't do the somatic work with a breathing
Mm-hmm.
technique for a client who's triggered by that. So
Mm-hmm.
like it is even something like a breathing technique, which almost universally benefits people.
Yeah.
We have to be aware of what's going on in our clients specifically
Mm-hmm.
because there are people who that won't work well for.
Exactly.
Yeah. So it's fascinating stuff.
I know.
Do you want to talk about the groups? Should we talk about rogue therapy?
Yeah, I mean that was kind of like one of those things too. Is like in private practice, like and probably my ADD, right? It's like, uh, hey, let's try something new, let's try something unique. And it's one of those things where it's like you try and see like what happens with it. So
Hmm.
we actually like paired up. So the way my private practice is like I have a private practice and it's my own little like thing, but then I like rent space out to like a bunch of other therapists, and it's kind of a collective.
Sure.
Like my vision of it was always that, like, because again, a lot of us who are in private practice, we're kind of on this island, and we're like, "Ugh," like we're kind of alone, right? And so it was my dream to like always have like a bunch of other providers that like we could shoot the shit and we could like walk down the hallway and be like, hey, what's going on today, and like not feel so alone.
Yeah.
So we had kind of like all got together, and we're like, let's promote this like series of like women empowerment
Hmm.
and that kind of thing. And like whatever our little passions are, we'll each month we'll do like a little thing based upon something we really find passionate. So each month we picked like somebody is doing yoga, and somebody was doing burnout, and somebody was, I did like unconscious processing, and like, whatever. So we picked one each month, and we provided like a little workshop for women to come to. So again, it was kind of like one of these things, like we had no idea if it was going to be successful or not successful, but we were
Yeah.
just like putting ourselves out there to just like try to create some community with women.
Right.
Some of them have been great and they've been really successful, and then sometimes it's like fucking crickets and nobody signs up.
Yeah.
So again, it's one of those things. I think again, as a private practice owner, as a small business, owner, entrepreneur, whatever, you just have to like try things. I think it's kind of like, I guess I don't look at any of it as like a failure.
Sure.
Like even though some of them have been flops, like, and nobody signed up for them,
Yeah.
and some of them have been great. But I'm like, just try shit. Like, I don't know, like,
Yeah.
because sometimes people leave and they're like, that was so amazing and I really got a lot out of it. And I remember having one woman come up to me afterwards and she's like, I was so anxious for coming, but I'm so glad I came. And that was like, again, my heart like swelled. I was like, oh my God, like even if just one person got something out of this experience and she fought through her anxiety, like that meant something to me.
Yeah.
So so it's been kind of an exciting, it was like it's been like a year long workshop in a sense.
Sure.
But yeah, it's kind of like it was like a little thing, but we've all been a part of it. So
Yeah, yeah, which is awesome, and I love stuff like that, and that's why I wanted to highlight it and promote it, because I get, I feel that on such a deep level of there are things we try as practitioners because it sounds like such a great idea. And I will say we often get really positive feedback from other people in the field.
Mhm.
So, like, one of the things that I got my certification in religious trauma, specializing in it, and almost nobody was doing stuff for purity culture. So, people who are raised in like don't have sex before marriage, and if you do have sex, you're gonna get an STD or get pregnant, and like all this horrific bad stuff about purity culture and conservative Christianity. All that stuff's geared towards women.
Mm.
And so I heard from all these other religious trauma therapists of like, oh, like you're interested in doing a men's group. That's such a good idea. Go do that. Go do that. Go do that. And finally, like, it's like, all right, fine, I'll do this group. Yeah, I don't like doing groups, but I was like, fine, nobody else is doing it. I'll do it. I have a specialty, whatever. One person signed up. And so it's like, it's a weird thing where like a lot of us in the profession, I think, are looking at it from a professional stance of like, that's great. We should get that information
Yeah.
out to clients. It's helpful. And it's not at all how clients are thinking about it. Even like marketing something like religious trauma has been weird because very few people identify as having religious trauma. Like that's not what they come into the door with. So yes, it's awesome, and like this stuff for females, safe spaces for them, and women's empowerment. Like that's awesome, and also like it's so weird in some of these things where you market it and it'll be a great idea, and right, no one signs
Yeah.
up.
And so yeah, sometimes too, it's like like again, not trying to get in your analytical brain, but like why did this? But we do. You sit there and you're like, okay, was it because it was this one? Nobody signed up because like they didn't, like one of them in particular was like in July, let's say, and it was like, masculine and feminine energy, right?
Mhm.
Like how does it manifest? Blah, blah, blah. And like me and the partner of mine, we were super excited. Her and I were like so excited to do it. We're like, oh yeah, this is gonna be so good. We prepped very well, and then like nobody signed up, and we're like, why was it? Is it okay? We're in Port Washington. It's kind of like small community, not a lot of, people might not sign up for it. It was the middle of July, or summertime, maybe
Right.
nobody signed. So there was a lot of this like analysis of why. And then you have to kind of just like let it go, and you're like, fuck it.
Yeah.
And we're not
Yeah.
gonna sit here anymore and think
And
about
that happens too with like building things. I do a lot of content creation, and so it's like, right, there's so many analytics and stuff out there that like don't mean anything.
Yeah,
But like
absolutely.
at least for me, the psychology brain kicks in on like the numbers and the research. Like that's so fascinating for
Mhm.
me. But also like, yeah, it's fucking TikTok. Like it's dumb. Don't
Yeah.
like define your success over whether something goes viral or not. Like that can't be the way we're defining success.
Thankfully, again, my brain just kind of like moves on from it. I'm like, oh, don't care. Next thing, boom, and I'm on to the next thing that is rewarding and fulfilling for me. So
Yes. Awesome. Well, this has been fantastic, Laura. If people want to learn more about your practice or work with you or find your stuff, where can they go to find more about you?
My main website is www.navigatewhg.com. So Navigate Wellness Health Group. Yeah, so they can check out stuff there. There's lots of stuff going on all the time and projects that we're working on and all that jazz.
Yes. And you're on Instagram, so we'll tag you on there as well. And all those links and stuff will be in the show notes.
Perfect.
So thanks for coming on. It's been
Thank you for
awesome.
having me.
And to all our wonderful listeners out there, thanks for tuning in again. We will be back with a new episode next week. Take care, everyone.